Hello, my name is Samantha Kim, and my partner Santiago Marin will be presenting the topic of methicillin-resistant Staphylococcus aureus, also known as MRSA. Staphylococcus aureus is a major bacteria-human pathogen that is responsible for nosocomial and community infections. It is a gram-positive bacteria that is cocci-shaped and forms clustered, which gives it its name of staphylococci. This bacteria is extremely important in the medical field due to its ability to cause a range of infections that can progress to serious illness. Healthcare providers are also concerned with its growing antibiotic resistance, especially methicillin-resistant Staphylococcus aureus. Infections by MRSA can either be mild or highly severe. The antibiotic resistance shown by MRSA is due to the expression of transpeptidase PBP2A. This allows the bacteria to be less susceptible to beta-lactamase antibiotics such as methicillin. MRSA can be found usually in skin surfaces and upper respiratory tracts, acting as a commensal organism. However, given the right opportunity, MRSA can become opportunistic and pathogenic, leading to serious infections. MRSA can cause a variety of effects on the body, even death. The serious effects of a MRSA infection can range from bloodstream infections, pneumonia, bone and joint infections, also known as osteomyelitis, endocarditis, and even death. The economic burden of MRSA continues to grow. A single episode of a MRSA infection could cost around $32,000 for an annual total of around $435 million. If measures are not taken to mitigate the growing antibiotic resistance of MRSA, millions of people will fall into extreme poverty in the next few decades. The economic burden will be disproportional, with developing countries being most at risk. Estimated deaths will be around 10 million by 2050 if MRSA continues to grow unchecked. This amount of deaths would cost the world 3.5% of its GDP, which is an equivalent of trillions of dollars lost. MRSA is usually not found naturally in the environment. However, due to growing MRSA infections in carriers, contamination of the environment has increased due to human and animal activity. Water and sand from public beaches have shown the presence of MRSA due to beachgoers. Wastewater treatment plants have also been a source of contamination of MRSA in the environment. Runoff from these plants have entered bodies of water such as lakes and oceans. Also, reclaimed water is being used in agricultural settings and it can contain MRSA, which is then passed on to livestock, which are then consumed by humans. MRSA can cause both hospital and community infections. As shown in the graph, Staphylococcus aureus has the highest percentage of isolates and hospital infections being the most prevalent. But meanwhile, in the community is the second highest bacteria present with a percentage of 14.9. If you contract a MRSA infection, you are 64% more likely to die compared to other bacterial infections. An initial infection of MRSA can be simple, but it can cause secondary infections. MRSA infections have poor outcomes for the health of a patient since its antibiotic resistance makes it more difficult to treat. Even the highest standard antibiotic to treat MRSA, vancomycin, is now starting to show resistance. The bar graph on the left demonstrates the different levels of infections in the United States and other countries. The level of MRSA infections in the United States is around 40%, which places the country in the top 10 countries with highest rate of infections. The map on the right demonstrates which countries and regions are the most affected with MRSA infections.
MRSA can affect the physiological events that occur in the body's immune system. MRSA has the ability of causing septic shock, which will activate the body's immune system and coagulation pathways. By affecting the events of the immune system, MRSA will lower the body's blood pressure and can cause organ failure. MRSA also affects the immune system's ability to attack foreign invaders by secreting anti-opsonizing proteins. These proteins will prevent chemotaxis within the body, which in turn prevents phagocytosis by neutrophils. MRSA can cause a wide variety of pathologies that can affect different organs and organ systems. MRSA can affect the respiratory system by causing pneumonia, which is the inflammation of the lungs' air sacs, which can be filled with liquids. MRSA can affect the skin, usually by causing cellulitis or boils. MRSA can also cause toxic shock syndrome, which causes an overall body reaction to the release of toxins by MRSA. MRSA can affect the bones by causing an infection known as osteomyelitis. MRSA affects the cardiovascular system by being able to cause the inflammation of the heart's inner lining. MRSA, when left untreated, can cause sepsis, which is the body's immune system going into overdrive, which can cause damage to the organs, and even cause death. Currently, the most common pathologies-related hospital-associated MRSA infections are cellulitis, pneumonia, and septicemia. Methods currently in use to prevent total world contamination are practicing better hand hygiene, ensuring contact precautions by using personal protective equipment when treating MRSA patients, isolating the MRSA patients away from other patients in the hospital, conducting active surveillance to screen for MRSA colonization, which includes screening patients for the bacteria before surgical operations, and focusing on improving sanitary conditions in the food industry. To decrease the contamination of MRSA, as individuals, we should practice better hand and body hygiene. Take care of clean cuts, scrapes, and wounds properly and keep them covered. Avoid sharing personal items, washing laundry before use of others, washing hands after touching dirty clothes, and seek medical attention if you suspect an MRSA infection. Testing for MRSA involves active surveillance of MRSA carriers by using selective culture, or PCR. The table demonstrates the costs and expenses involved with the main test for MRSA screening. The chromogenic agar is a traditional microbiology technique that costs around $12 per test, and when including hospital expenses, amounts to around $364 per positive case. Meanwhile, the PCR screening test, Gene Expert MRSA assay, is newer technology that can deliver rapid results. However, it is more costly at around $47 per test, and when including hospital expenses, it can cost around $600. Areas that should be tested are food industry processing sites, hospitals and healthcare facilities, and crowded community settings such as prisons, military bases, daycares, schools, and public recreation places.